Hi there, I'm Dr. Jennifer Fitzgerald, Naturopathic Doctor and co-founder of Conceive Health. I'm going to talk today about the 90 days of preconception. First, a few stats on fertility. So infertility is defined as the inability to conceive after 12 months in couples who are under age 35 or 6 months in couples who are over age 35. Approximately 15% or 1 in 6 couples in Canada will experience difficulty conceiving. The top reasons for patients seeking fertility care in Canada might surprise you. It's often assumed to be for a female issue. However, the number one reason in 2021 for couples seeking treatment was unexplained infertility, which means there's no obvious cause of the infertility. So all their testing is normal. The second most common cause was male factor, the third, advanced reproductive age, and the fourth, diminished ovarian reserve. The numbers for social egg freezing are also up. There was about a 27% increase in fertility treatment cycles in Canada compared to the previous year. And the numbers for social egg freezing were increasing by almost an 80% increase in elective egg freezing cycles in Canada between 2020 and 2021. So the preconception period refers to the 90-day period immediately prior to conception. This is the time where the eggs and the sperm are maturing and developing. Improving the general health of both partners prior to conception improves reproductive outcomes. There are several preventable lifestyle and chronic health diseases that can impact fertility, egg and sperm quality, as well as pregnancy outcomes. These might include things like high cholesterol, insulin resistance, diabetes, endometriosis, PCOS, and many others. The sperm and egg quality depend on several different factors during this approximately 90-day period. So things like age, nutrient status, exposure to things in our environment, the level of stress we are under, certain genetic variables or predispositions, things like immune function, exposure to infections, or even endocrine or hormonal imbalances can impair the health of our eggs and sperm. Once fertilization is happened, the blueprint for this embryo is set. So the opportunity to improve the quality of the embryo actually becomes before conception with the health of the egg and the sperm. This image highlights the 90 days of follicular development, so how the egg matures over time. It is well known that females are born with all of their eggs in their ovaries. However, they remain in a suspended state or hibernation state until the female goes through puberty. After this time, once a month, a handful or a cohort of follicles will be activated, and they will enter into this 90-day period of maturation and development. There's 3 main processes that we're considering in this 90-day period of time. So number 1, the eggs require the building blocks, so the tools that they will need to thrive and survive during the 90-day period of time. We also are thinking about protecting their DNA, and DNA is vulnerable to something that's called oxidative stress. So the main part is to protect the cells from oxidative stress, and we also want to support mitochondrial function. This means cellular energy. So both eggs and sperm require a decent amount of energy in order to be able to fertilize or create an embryo properly. This image looks at a similar thing, but in sperm this time. And as we know, men are not born with all the sperm in their testicles as women are with their ovaries. However, sperm have a similar developmental time in that it takes approximately 90 days for a full cycle of spermatogenesis. So meaning if we were to completely overhaul an entire sperm population, it takes approximately 90 days. And again, the sperm would be vulnerable to any of the things that they encounter, any things they have access to during that window of time. So both eggs and sperm require good functioning or optimally functioning mitochondria. So mitochondria are powerhouses of the cell. They're sort of like the engines of our cells, and they create energy or ATP. So eggs in particular contain more mitochondria than any other cell, typically almost 500,000 mitochondria per cell at the time of ovulation. When an embryo is created, all of the mitochondria that end up in that embryo are of female origin. So that means we take the nuclear DNA from a sperm and incorporate it into the egg. So we have two copies of nuclear DNA, and we have the mitochondria from the oocyte. And these mitochondria are responsible for driving the energy behind embryogenesis over the next 5 to 7 days until implantation takes place. So, why do we care so much about mitochondria? Because they produce the cellular energy that is enhancing the embryonic growth. The eggs are developing the mitochondria and energizing the egg during that preconception period. So, this is the period of time we want to make sure that the egg and sperm have all the nutrients that they require so that their mitochondria are functioning well and they're producing all of the energy that they need. We can support mitochondrial development with using things like antioxidants to support the health of eggs and sperm. We can protect them from damage by optimizing our life cycle and preventing exposure to certain things. And we can also improve our diet and our lifestyle to make our bodies more efficient at the production of antioxidants. The goals of the 90 days of preconception care are to optimize the quality of both egg and sperm prior to conception. We want to improve both reproductive and fertility outcomes as well as pregnancy outcomes. We want to ensure that the building blocks are present for both folliculogenesis and spermatogenesis to occur properly, as well as embryogenesis once fertilization has occurred. We can do this by removing factors known to be detrimental or negatively impactful for fertility. We can protect against DNA damage and reduce oxidative stress. And we can also optimize mitochondrial function and improve cellular energy. In terms of the assessment of preconception through the ND lens, we offer a variety of different testing and assessment options. So typical assessment will include nutrient testing, things like vitamin D, vitamin B12, ferritin, which is iron, beta carotene, vitamin A. We also assess metabolic markers such as lipids, inflammatory factors, fasting insulin and glucose, hemoglobin A1C, and calculation of the HOMA-IR, which is a marker of insulin resistance. And we also might consider functional testing or other options. They might include micronutrient testing or other types of specialized testing, depending on your individual needs. An ND might also calculate BMI or body mass index, or even more accurate would be a BIA or body composition analysis to fully understand the metabolics of the individual. Other assessments that might be done by your reproductive endocrinologist or fertility specialist, some of which could also be done by a naturopathic doctor, would include day 3 hormone assessment, ultrasound and sonohistogram, as well as endocrine assessments such as thyroid, prolactin, AMH or anti-Müllerian hormone, assessment of androgens or otherwise indicated. So the 90 days of preconception offers an opportunity for couples to improve their reproductive health, both through the lens of egg and sperm, in order to optimize their health and the health of their future offspring. If you have any questions about preconception care or how our NDs at Conceive Health might be able to assist you in your fertility journey, please check out our website. You can check us out on social media like Facebook and Instagram, and you can also book a 15-minute discovery call directly through our website, where we can answer your specific questions about your individual needs. Thanks for listening and have a great day.